One of the dominant narratives right now about the opioid crisis is that, it all started with unscrupulous prescribing and physicians gone rogue and pill mills. And also recently there's been some revelations about pharmaceutical companies really pushing certain opioid drugs like OxyContin onto doctors and engaging in very aggressive marketing tactics to try to increase prescribing. So in some ways that narrative has merit, but that's really not the whole story. I think that just blaming physicians and pharmaceutical companies for this issue is something that's convenient, but it actually misses the point because, for example, in the same time, we've seen an increase in the use of alcohol. We've also seen increase in prescription of other medications, not just opioids. There's been a lot of very major demographic, economic, social change in this country since the late 90s. And I think in a lot of ways, the increase in opioid consumption is something that is a result of other structural factors that help explain why doctors have been prescribing many more of these medications. In other words, there's been an increase in demand for pain management, both for mental health issues and for physical pain. And so to peg everything on unscrupulous physician behavior is something that I think, again, is a simple answer, but misses a lot of the root causes of the problem.
There is almost nothing more painful for us humans as social beings than the experience of being excluded from the group, that experience of shame and embarrassment of being excluded. And we see that adolescence is a particularly intense time when people are trying to find their social identity, figure out who they are, especially today, where an insult can be communicated so quickly by social media or by texting. So I think that just creates that experience of suffering in a way that I think people are looking to escape. And so there is something about social pain that I think really leads to substance use. I think we also see that across different geographic areas, there are places that are really down on their luck, where it's hard to get a full day's work, and that's going to make you feel good about yourself, and that there's a history of generations of substance use. And what we see in our work here is that the children who grow up in those environments have a much higher likelihood of ending up using substances and having addiction, partly because it's more difficult to be successful in school and more difficult than to have the job opportunities that you'd like to be able to feel good about yourself. And also, I can name 15, 20 times that I've heard people starting using with an uncle, with a parent, when they were in early adolescence. The likelihood that they might also pass that skill or dysfunctional skill onto their child is fairly common.
Many patients will describe periods of time where they're under so much stress or they're having such difficulty coping with their lives that they'll sort of turn to whatever's available, whether it be opioids, whether it be another addictive substance or another relationship with an addictive substance. Other people will say, I have a primary drug of choice, or I have a primary relationship with a substance, and it really is it kind of trumps everything else. It's a more powerful, connected relationship with this drug than any other thing I've ever tried. And so it's a lot of this is just about being curious with patients and trying to be as non-judgmental as possible to understand why they have these relationships. Because sometimes patients have never been asked those kinds of questions. What do you like about this substance? Because when we think about what opioids, let's say, are doing in this person's life, what the destruction might be in their life, the pain that the addiction is causing, we also have to be curious with ourselves and with the patients if there weren't at some point a perceived positive thing that this was doing for them, it probably never would have started. And sometimes when we ask questions like that, we'll learn really important really important things that help us take better care of patients.